workplace. 2 million of those being workers in the construction industry, thereby showing the need for understanding silica exposure, its health effects, and the use of effective controls in an attempt to reduce exposures to these workers. But more importantly, I'm sure the majority of you are here to gain a better understanding of the new OSHA revision, which was created by OSHA to help save the lives of those millions of workers who are exposed to silica daily. This new federal standard went into effect on June 23rd, 2016, after which industries had a time period between 1 to 5 years for compliance, depending on the industry classification. The construction industry had 1 year for compliance. However, if you see below, you see the September 23rd, 2017 date. And this is because the enforcement date has been pushed back to the 23rd of 2017 in September due to various pushbacks from the construction industry and various requests for clarifications of the document. OSHA approved state plans, such as Cal OSHA, has, in other states that have their own state plans, have 6 months to adopt standards that are at least as effective as the federal OSHA standard. Because I am in California and the majority of our offices are in California, we'll go into a little detail about Cal OSHA specifically because it's pertinent to us. However, if you live in a different state, I recommend you looking to see if your state plan has changed with regard to the new OSHA revision. But Cal OSHA has adopted exactly the same standard as federal OSHA and also has an enforcement date of September 23rd, 2017. Therefore, if you start looking into the standard now and its new requirements, which differ greatly from the old standard, it's a great time to begin. In this webinar, I will attempt to simplify the standard for you and provide some information on what the key provisions are and some of the difference from the old standard. Okay. So although the health effects of silica have been known throughout history, the greatest exposure disaster with regard to silica and occupational hazards in U.S. history is Hawk's Nest Tunnel. This is a tunnel in West Virginia, and it was in the early 1930s. Hawk's Nest is a 3.8-mile tunnel that began construction in 1930. The material that these individuals were crushing, pulverizing, or removing was said to contain as much as 99.44% pure silica. Within 2 months of this project, workers began dying of silicosis. By the time the work ended, they estimated about 476 workers died of silicosis, and estimated about 1,500 developed the disease within 1 to 2 years. And this is actually said to be a very understated estimate, and they expect that there was probably a lot more than that. This actual disaster prompted a congressional call to action for silica exposure and also other occupational health issues. So what is silica? Silica is the name given to a group of minerals composed of silicon and oxygen. These are two of the most abundant elements in Earth's crust. Silica is found commonly in the crystalline state, the most common form being quartz, which I'm sure you've all heard of. However, it can also be found in the form of cristobalite and tridymite, which is important to know because when collecting air samples for compliance with federal OSHA and Cal OSHA standards, you do need to sample for all 3 forms of the crystalline silica. Crystalline silica is a basic component of soil, sandstone, granite, clay, and other minerals. So basically, it is here to stay. It's been here before us, and it will remain to be here after us. So the idea of substituting it and it not being around is not going to happen. So when discussing silica and crystalline silica in the construction industry, silica, specifically quartz, is found in a major amount of building materials. That being concrete, brick, and mortar materials, which is obviously a large portion of the construction industry. So typical exposures to silica occurs during mechanical work on these silica-containing materials. What happens is when you start breaking apart and doing mechanical work and causing this large piece of silica to become the respirable size fraction and airborne, you start to inhale it, and therefore then it becomes a hazard. However, we shouldn't forget that silica exposure can also occur during mixing and handling of silica. So it's not necessarily just grinding, cutting, jackhammering. Also when handling the dry concrete mixing materials, there's potential exposures. So what are some of the health effects associated with silica exposure? The most common being silicosis. Silicosis is a lung disease caused by breathing the respirable size fraction of silica dust. The respirable dust can cause fibrosis, which is a scarring of the lung tissue. Symptoms of silicosis can appear from a few weeks to many years after exposure, and typically worsens over time as scarring of the lungs occur and become greater. Here is an X-ray of some lungs that have nodules that are caused by the silica exposure. Silica can further be classified as either acute, chronic, or accelerated. It is also a very debilitating disease that can also be fatal, and there is no cure for silicosis. Silica is also classified as a Group 1 carcinogen by the International Agency Research of Cancer, and is also associated with other lung diseases such as COPD, which is chronic obstructive pulmonary disease, and tuberculosis. So silica dust exposure and OSHA updates. So what are the updates that you should be aware of? As previously stated, federal OSHA and OSHA-approved state plans have recently updated their standards on silica, and obviously that's the reason why you are listening in today. There are standards for the construction industry, general maritime industry, and hydraulic fracturing industry. I've listed some of the new standard numbers for you on here, and also for California, like I stated, since we are primarily out of California. For the construction industry, the standard will apply to all job tasks where airborne concentrations of crystalline silica may exceed the action level of 25 micrograms per cubic meter. So what does this mean? So in a nutshell, the purpose of the revised standard is to require employers to limit worker exposures to respirable crystalline silica and to take other steps to protect workers. So how do you plan on doing this? Well, one way to do this is to reduce the permissible exposure limit for crystalline silica. Previously, if you were following any of the federal OSHA standards, you used a calculation-based PEL. And what this was is the PEL was determined based on the percentage of respirable crystalline silica measured in your sample to the amount of dust that was collected and measured in your sample. So there were various calculations for the form of crystalline found, quartz, or if you found quartz and crystallite. The industry you were in, so general industry, had a different calculation than the construction industry, which made for a very confusing laboratory report and very confusing data analysis. California, on the other hand, had previously has had just a specific concentration PEL that was referenced for each type of form of crystalline silica you sampled for. However, now they all are completely the same, and they use just one single number for any form of the crystalline silica. So it is now 50 micrograms per cubic meter if you find quartz, 50 micrograms per cubic meter if you find cristobalite, and 50 if you find the tridymite. At Cal OSHA and Federal OSHA have now developed an action level, which is also the same for any form of the crystalline silica identified. And as stated earlier, this action level kind of triggers whether or not you need to be following the standard. And this action level was previously not a part of any of these standards that I've referenced. Another change to the PEL is that total dust crystalline silica quartz PEL has now been removed. So if any of you are hygienists, you may recall when you used to have to collect samples for crystalline silica, you would collect both a total quartz sample and then respirable sample, which wasn't very easy to do because of pressure issues with your pump. So you would typically have to run 2 different pumps on one employee just to compare to the permissible exposure limits. So as I stated, if you meet this action level, all construction employers covered by the standard must follow the following. They are required by the standard to cover the following, which would be establish a written exposure plan. They need to designate a competent person, and I'll go into detail about each one of these further in the presentation. They will have to restrict housekeeping, offer medical exam, train workers, and keep records. So what is a written exposure control plan and what must it entail? At a minimum, it should include a description of the tasks in the workplace that involve exposure to respirable crystalline silica. So if you are in the construction industry, I'm sure you're aware that this would include a variety of general work tasks you provide on a daily basis. You also have to include a description of the engineer controls, the work practices, and respiratory protection used to limit exposures to the employees for respirable crystalline silica. And this is specific for each task as well. So it's not just a general list, but if you're doing grinding, how are you going to control the employee? And if you're doing chipping, you're going to describe exactly how you plan on controlling those exposures as well. So it's specific for each work task. You're also going to have to include a description of the housekeeping measures used to limit employee exposures to respirable crystalline silica. And the written exposure control plan will need to have an annual audit where the employer will review and evaluate the effectiveness of their written exposure control plan at least annually, or update it as necessary. So if you determine there's a need halfway through the year based on some work practices you have identified, then you need to do that. So designation of a competent person. So what is this? The standard defines the competent person as an individual who is capable of identifying existing and foreseeable respirable crystalline silica hazards in the workplace, and most importantly, an individual who has authorization to take prompt corrective measures to eliminate or minimize them. So what OSHA is trying to prevent is employers from just noting anybody in their plan as a competent person, but instead they want someone who has authority to go ahead and implement this program adequately. Next is restrict housekeeping. Wherever an employee's exposure to airborne concentrations of respirable crystalline silica is or can reasonably be expected to be in excess of the PEL, the employer shall establish a regulated area. So how will this be done? It's the portion of the standard that prevents exposure to adjacent trades. So as you are well aware, when you're working on a construction project, you may have, the electrical guys in there, the grinder, people doing grinding work, and there's a whole lot of work going on at one time. So the point of this key provision is that they want to try to prevent adjacent trades and people not working with silica containing materials to not be exposed to theirs as well. So this can be done through proper signage, and the standard has specific signage that is required, and you can look that up in the standard. Or during tailgate trainings or meetings in the morning, kind of letting people know there's going to be grinding work done on the 5th floor, so we're going to restrict access for the first portion of the day when we know that there's going to be a lot of dust generation. And also housekeeping measures are specifically spelled out. So the standard prohibits the use of dry sweeping or the use of compressed air unless other wet methods or HEPA vacuuming cannot be utilized. However, wet methods and HEPA vacuuming, not shop vacs, but HEPA vacuums, are the recommended cleanup method. They also talk a little bit about not just bringing anybody in on housekeeping, that people are aware of the potential hazards and have been trained in HAZCOM, which we'll go into detail later about, on what they may be cleaning up. Also, another key provision is a medical surveillance program. So any employee who is required to be enrolled in a medical, all employees who are expected to wear a respirator for more than 30 days a year are required to be enrolled in a medical surveillance program. This program will include a baseline chest x-ray, a physical exam and TB tests, along with periodic tests every 3 years or earlier if needed. So you're going to have to enroll these people if you anticipate them being exposed or wearing respirators for more than 30 days a year. An additional key provision is communication of respirable crystalline silica hazards to employees. This is also known as hazard communication or HAZCOM training to people. This training shall include, at a minimum, the health hazards associated with exposure to respirable crystalline silica, specific tasks in the workplace that could result in exposures, including what specific measures will be implemented to reduce exposures and protect employees from the crystalline silica, including engineering controls, work practices, and what respirators will be used, if any. It needs to include a description of the standard and some of its requirements, which we are going over right now. It needs to provide the identity of the competent person, so whoever is doing work is aware of who they need to go to if they have questions, or who is responsible for implementing the program at their specific workplace, and the purpose and description of the medical surveillance program so that they are aware of what needs to be done in order to be a part of their medical surveillance program. And last but not least, an annual audit of the program, as I stated. The standard requires employers to review and evaluate the effectiveness of their written exposure control plan at least annually and update it as necessary. So those are the key provisions of the standards. Now we can go into detail on how to control these exposures. So those are all the portions that need to be a part of your program, but now we will talk about how you can control exposure. So as we know, the most important way to reduce silica exposure in the construction setting is to control the generation or release of airborne dust containing silica. Then the new standard provides 2 exposure control method approaches. Employers have the choice to either use the control method laid out in Table 1 of the construction standard, which is called the specified control method, or they can measure workers' exposures to silica and independently decide which dust control method best, what dust control methods work best, to limit exposure to the PEL in their workplace, which is called the alternate exposure control method. Both methods have their own pros and cons, which we can discuss.
Hey, Michelle, I got a quick question real quick. Yeah. We had someone ask if there is still a requirement to types of silica on a lab report.
I'm sorry, can you say, I couldn't hear you. State that again.
Is there still a requirement to types of silica on a lab report?
To type the silica? Or
yeah,
what?
You have to specify the types of silica.
Yes, so when I send in a sample on a COC, I will ask for quartz, tridymite, and crystallite. I'll spell it out specifically, so you need to sample for all 3 of those because there are permissible exposure limits for all of them. However, quartz is typically the one that's found the majority of time, and rarely do we find crystallite and tridymite, even less. but just for compliance with the standard and permissible exposure limits, I request all 3 forms. And you could just write 3 forms in there because there are other rare forms, but as I stated, the permissible exposure limits are only spelled out for the quartz, chrysoberyl and tridymite. Okay, so the specified control method. So this is the approach that utilizes Table 1, which is provided within the standard. Table 1 matches 18 common construction tasks and scenarios with specific dust control methods. So it kind of lists out exactly what employers need to know and how to limit worker exposures to silica. The dust control measures are also listed in the table and are included to be known effective methods. Some of the methods they use are water or air or vacuum to capture dust. In some offshore operations, respirators may also be needed. So here's an example of Table 1 in one of the sections. So the example or equipment and task is a handheld power saw with any type of blade diameter. If you're using this saw equipped with an integrated water delivery system that continuously feeds water to the blade and you're using it outdoors, it states that if you do this work less than 4 hours using this water delivery system, that no respiratory protection is needed. However, if you plan on doing this same work for greater than 4 hours, it states that you need a respirator with an assigned protection factor of at least 10. It also says if you're using it indoors or in an enclosed area, if you use it at any time less than 4 hours or greater than 4 hours, you need to wear respiratory protection. So
Michelle, I got a couple more questions that
go
came
ahead.
in when you get to a good stopping place. The first one, can you address drywall mud sanding?
If it contains, so the table, if you're looking at the table, it just talks about any silica containing materials. So if you are in California and you used to follow the standard 1530.1, it used to talk about engineering controls and dust control systems for just concrete masonry materials. However, if you're looking at the new standard now, it does not state concrete or masonry materials. It just states now silica containing materials. So if drywall contains silica and it doesn't specify what concentration or what percentage, you are now required to follow the standard. But again, only if you are believed to be above the action limit of 25 micrograms per cubic meter. So unlike 1530.1, which just talked about control methods and controlling concrete masonry materials, the new standards are now encompassing all silica containing materials. So if you're talking about drywall materials that contain silica, then yes, the standard will apply if there's a reason to believe that exposures will exceed the action level. So hopefully that asked the question. If it didn't, please specify and ask a different one as well. So the tables provide, as I stated, 18 different common construction tasks, and it lists a specific engineering and work practice control method that needs to be utilized. So this is a great way to look and control exposures. If you use this method with the tables and the specified control method approach, you do not have to collect any air samples and do not need to do any air monitoring for compliance. So you won't have to have people collecting samples to determine if the person is exposed to below or above the PEL. However, if you do use this method, you have to follow it to the T. You cannot change anything within the table. Also, if you do use this table, all workers must be enrolled in a medical surveillance program and respiratory protection program. So it's a great method if you have small business and companies that just do specific work tasks that they could fit in within this mold or this table. However, as I assume with majority of construction companies and majority of construction industry, it's not as easy as that. Specifically, an example could be if you are doing work on the 20th floor and you're using a handheld saw, using a water delivery system may not be feasible at all. So therefore, you are no longer able to use this table in order to meet your needs. So therefore, you may need to use the alternate exposure control method. And this method is for all tasks that are not listed in Table 1. And again, those are 18 different tasks, and I recommend you go ahead and take a look at those. And it's also for where employees can't fully or properly implement the engineering controls and work practice or respiratory protection. So as I stated, you may be doing a task that's in Table 1. However, due to restrictions of your project, you may not be able to use the water system. So therefore, you can no longer be a part of the specified control method. You will now have to use the alternate exposure control method approach.
Michelle, I have one more question about the drywall. A gentleman asked if it's less than 1% silica and drywall mud, according to the SDS, do they still need to sample?
It sounds like there's maybe reason to believe that the person won't be exposed to it above the action level. But again, a lot of the times just doing an exposure assessment just to confirm a, in parentheses, negative exposure would be a great way to confirm that this person, and when this work is being done, that they're below the action level of 20 micrograms. And then I'll also talk a little bit, and we don't always have to sample. There's, when I go further into this alternate exposure control method approach, they also say that you could do different forms of two different assessments. And one is using objective data as your reasoning to why this person would be below an action level. So we'll go into that a little bit detail. So there are different options within the alternate exposure control method approach. So I'll go back real quick. So employees who have reason to be expected to levels above the action level should and cannot be within the specified control method approach will have to use the alternate exposure control method approach. And so I was just stating there's two different ways you can approach this. You can do a performance option, which is used as a combination of error monitoring data or objective data, which could be industry data, prior exposure assessments, research. I know a lot of companies such as Hilti and other equipment manufacturers have done a lot of research on how their specific equipment reduces exposures to silica. So if you gather enough research and data, you can probably use that as well in determining whether or not your person will be exposed to levels above the action level. Or if you want to start from scratch, you can just do the scheduled monitoring option, which would just be the traditional exposure assessment. And what I've recommended as well is that if you're going to use this performance option or scheduled monitoring option, that you as a company also start creating a table of your own. Instead of calling it Table 1, you can call it Table 2 or whatever you'd like, and start gathering as much information as you have company-wide on specific approaches and assessments you've done to date that show compliance or levels that are below action levels or above, if that's if that's occurring, to start gaining all this information so you can create tables too to show company-wide, hey, if we are doing this drywall work and the material is less than 1% of the drywall ingredient, if you do work in an enclosure for greater than 4 hours, levels are, non-detectable or below the action level, so no respiratory protection is required. So you are, you yourself are kind of creating your own table to justify what control methods you are going to use for specific work tasks. So let's dive a little bit into some examples of some exposure control. So again, if you're using the alternate exposure control method approach, you do not have specific exposure controls outlined for you as they do in Table 1. So you can use wet or dry methods. You can use local exhaust ventilation system, fans, but again, as long as you're not blowing it to other trades. You can perform work activities and training and preparations, respiratory protection. Again, that should be the last means of protection. Hygiene, personal housekeeping, isolation of the work area, substitution of materials, and also just general training and positioning of employees so that they know where to maybe stand or hold their head so they're not being, the dust is not going specifically to them. And I have a video I wanted to show real quick, and it's just something I grabbed from YouTube, sorry. And it's Hilti showing their dust control systems and the differences between using a system and not using a dust control system. So we'll just show a little bit of that. So on the left side is a equipment that is not using any dust control system. So as you see, you can tell the difference in the amount of dust being generated. And then on the right side here, their equipment has the dust control systems on it, and you can obviously see the difference in the amount of dust that's being generated. And a lot of equipment these days are equipped with these type of dust control systems, so it's great to use those in all of your work practices, again, because the way we're going to control silica exposure the most is by controlling our dust.
Michelle, I have another quick question for you. Do we have a library of sampling data that we can use as a reference?
You're going to have to say it a little bit louder. I'm sorry, Carly.
That's okay. Do you have a library of sampling data that we can reference?
At FACS or industry? I mean, at Forensic Analytical, we have done various job safety analysis kind of experiments, we can call it, or training, where we've kind of developed these specific parameters and have done sampling with different types of equipment or different dust suppression methods or control systems, and have evaluated it somewhat in-house, and for companies to help determine what's the best exposure control methods to utilize for projects. So we've done that as a company. I haven't really looked industry-wide, but I'm sure there is probably stuff available out there. And like I stated, I've seen from Hilti, they've done some research as well to try to prove, and again, I'm just using Hilti because that's the name in my head. There's a lot of other manufacturers that have great pieces of equipment, and I'm sure have done the same, but have done, studies to show the reduction of silica exposure or dust exposure when using specific control methods. So along with the changes in the standard, it does a little bit in terms of changing of sampling and analysis. So I'll go into, and I'm sure there's not a lot of IHs on here, but I'm going to go into a little detail about that as well. So if you decide to use the exposure control method and need to collect samples, you will need to do some forms of air sampling. So silica samples are collected on 37 millimeter, 5 micron size PVC filter cassettes. They are collected using a cyclone apparatus, and what this is a little cyclone that helps filter out and collect just the respirable fraction, which is what we're looking for analysis. The sample pump and cyclone collector must have match flow rates to ensure that the correct particle size collection is being used. And the reason why I'm saying all this is that silica sampling is not the easiest form of sampling. You really have to be specific in what and how you collect it, and making sure you use that cyclone the way it's supposed to be used. There's different cyclones that have different flow rates that need to be used. So when collecting it, you need to make sure that you're using the right flow rate, which can vary between 1.7 liters per minute to 4.2 liters per minute for the specific cyclone you are using.
Hey, Michelle, I have another question for you.
Yeah.
When do you apply containment or negative air enclosure?
It would depend on your project specific. So usually, obviously, if you're working indoors, you may be using a negative pressure or a negative pressure machine, but it all depends on the size and the area. Sometimes if you're working in a large space and you're in the corner there doing your work, you may not necessarily use it, but let's say if you're working in a small bathroom and you've got to do some chipping, maybe you might want to utilize that to, one, not to have it, the particulates in your area go out to the adjacent occupied spaces, or to control the dust and maybe filter it out as well, along with your control system.
Okay, and one more question. Shouldn't the samples be collected at the operator level versus the substrate level? For example, not at the floor, but at the average height of a construction worker?
Correct. So I'm discussing all personal exposure. So yes, for a personal exposure assessment, and if you're trying to assess and do area samples, you should always have it on the lapel of the worker. So the cyclone picture you see here would be right at the lapel, where you would clip it on right there, so that it would be representative of what the employee would be inhaling. So again,
okay, another question.
Go ahead.
Oh, sorry. Would you recommend third-party testing or in-house testing? And what liability are we incurring by in-house testing over third-party testing?
So I guess what I was trying to get at for this last slide is that, I mean, if you do have someone who is very knowledgeable on how to collect a sample for silica, then by all means. However, as I stated, they're very tricky. and we only know this once you've done several of them. You have to have it in the correct, you have to have the cyclone cleaned, held in the correct manner, adhered to the filter correctly in the cassette to collect a good representative sample. So it's pretty cumbersome. And so I typically recommend, if you don't have someone who's very knowledgeable about this, to have a third-party consultant do it. And by all means, if you have someone who is very knowledgeable, have them do it. But again, liability-wise, I think it's best to have an industrial hygienist do the work, a third party. And again, because not only are we just collecting a sample, but as in all industrial hygiene, collecting a sample is only one portion of the assessment. When doing an assessment for silica specifically, watching the employee, watching the work practices, looking for airborne dust generation, seeing where it's going is very important, because there's been times when you've seen a lot of dust being generated and you get nothing on the sample. But what does that mean? Does it mean the sample wasn't collected properly? What was the dust concentration? So there's a lot of work then entailed in silica assessments. So I recommend, unless someone's fully knowledgeable, that you hire an industrial hygienist to do the work, just because of it being fickle and the cumbersomeness of doing the work. Okay, so I've already went over this. So there are, sorry. Also, real quick, also due to the very low, the new low permissible exposure limits, samples need to be collected for longer periods of time. So I know sometimes people say, can you come evaluate this one work task? We're going to be grinding for an hour. However, in order to get a sufficient amount of volume through your sample medium, you need to collect a large, you need to collect the air sample, sorry, you need the air sample for a large period of time. So let's say if you're using a aluminum cyclone that has a flow rate of 2.5 liters per minute, the lab generally recommends you get around 1,000 liters in there. In order to get a sufficient detection limit, you will need to sample for more than 6 hours. So just a heads up, you can't just go in and do one task and say whether or not that task needs this specific exposure control or respiratory protection in this 1 hour. You kind of need to do a full assessment that lasts for, about 6 hours in order to get detection limits low enough to compare to these permissible exposure limits, because the levels are so low now that you need a lot of air to go through that media system. So there are 2 testing methods currently accepted by the standard. One is the X-ray diffraction, which utilizes NIOSH method 7500. And there's also the infrared spectroscopy, FTIR, which utilizes a NIOSH method 7603. And a lot of the time, I also like to collect and have the samples analyzed for just total dust, not total meaning the size fraction, but non-specific dust. So just weighing out the dust to see how much dust is getting collected. And that's just good for general knowledge, even though we're comparing our numbers to the Silica standard, finding out how much dust you're getting on there can show also the effectiveness of your dust control system.
Quick question for you, Michelle, if I can jump in. What if a task would not occur continuously for 6 hours? How do you test then? So
what we have done is sometimes people we'll have to usually run, sorry, this question gets asked a lot, and so I've gone through a million different ways we can do it, but sometimes what we've done is kind of just have them do the work, and if it's spread out throughout the 8 hours day, then let's just collect an 8-hour sample, and then we'll just write in our notes, and we kind of put in there how long is a work within that 8-hour work day include just as silica containing dust generation. Or we've had people kind of do worst case scenarios sometimes, because maybe the day we're out there, they're only doing 30 minutes of it, but sometimes it may involve up to 4 hours. So they may just kind of do a mock assessment to try to show a worst case scenario so that they're being covered for other times in which they may have more work. So typically, that question could be answered on a project-specific basis. So we typically work with the client on figuring out how's the best way to approach that. But again, we don't want to collect smaller samples, because again, if you get a detection limit that's higher than the permissible exposure limit, how can I say you're in compliance? Especially if it says that you have nothing detected, but yet the detection limit is greater than the permissible exposure limit. So we'd rather not do that. We'd rather show data that shows we have a detection limit that's lower than the PEL and the action level, and you show that your levels are below that, or if they're higher, then that we'll address that as well.
Okay. And I have another question as well. Can you use a cyclone from BGI that operates at 4.2 liters per minute, injection volume of 1,008 over 240 minutes?
Yes, you can. So sometimes we use that as well. We typically use the aluminum cyclone because we like it, and we're able to take care of it and pretty well, and it's a little bit easier for to use. So, but there is that option as well. So again, it's project specific. We'll determine what best way to approach it in order to help capture the correct amount of volume for whatever project objectives we're trying to meet. So yeah, so that's one good thing about the different cyclone, is that you can do 1.7 to 4.2, but you would have to acquire that specific cyclone. Okay, so I'm just going to kind of wrap up here again and talk about a little bit about compliance. So again, this is stuff that I want to reiterate because I'm sure you want to know that. So again, the construction standard, the enforcement will take place and was pushed back and will take place on September 23rd, 2017. However, I'm sure a lot of you have heard there's been some word that maybe it gets pushed back even more. But if I were you, I would start now and at least start getting your ducks in a row and identifying what you need to do in order to become compliant with the standard. General industry has till 2 years after the date, so that be let's say June 23rd, 2018, unless that's pushed back. Hydraulic fracturing, which I don't think anybody here is doing that, is June 23rd, 2018. So those are the compliance dates. So if you were talking about construction, you have until September 23rd, 2017 to get this program in place. However, the permissible exposure limit is in place, the new ones, so you are required to be in compliant with those permissible exposure limits at this time. Also, OSHA approved state plans have 6 months to adopt the standards that are as least as effective or the federal OSHA standards. So as I say, Cal OSHA is following federal OSHA exactly. It looks like, and their enforcement on the website is noted as September 23rd, 2017 as well.
All right, I have a couple questions before we head on. The first one is, in construction, we often have multiple trades or employers performing silica generating tasks right next to each other. What is your recommendation for approaching those exposures?
So what I've been telling people is that those other trades should also have their own silica program management or written exposure control plan. So what I've recommended to some people is that becoming more involved in identifying when you do a project with other trades, that you find out who their competent person is on site, and also find and identify during maybe your tailgate meetings in the morning or before project starts what their plans are to control exposures, because everyone who has individuals that can be exposed above the action levels are required to use this plan. So no longer should you just, worry about your own company. You should also start looking to how are other people controlling their dust as well. So by either identifying who the competent person is, talking with them and seeing what their plan is, and also identifying what specific controls they'll be using, because as stated in the plan, they should be having restricted areas. So you should be identifying where those are when you're doing your work.
Okay, and then a couple more, piggybacking on that last one. What if you are taking down a whole building? Do you have to contain the whole thing?
That's a good question. I haven't been asked that before. Well, you should be. I mean, typically when you're taking down a whole building and you're using large pieces of equipment, so you're not necessarily directly in the area. You're usually a little bit farther, and you're usually should be using just exposure control methods just for public safety of adjacent areas. So that's a good question. I'd probably have to look into that a little bit more, but again, you should be collecting samples for silica just to see whether or not the person's being exposed, but typically you're still using a lot of these dust control methods, well, at least water suppression methods, to reduce the dust levels from the work area and entering adjacent people occupied spaces, population.
Okay. Awesome. And then another question, if you were going to do sampling, how many samples per task would you recommend?
So that again depends on various scenarios. So if you're telling me that you only do it in these specific parameters, then maybe you need to take a few samples. But if you have various parameters that we could look at, like for instance, indoors versus outdoors, 10-foot by 10-foot area versus 30-foot by 20-foot area, I would recommend starting off with some of the worst case scenarios and identifying if you're above the action level or the permissible exposure limits. And if you aren't, then it's probably safe to say that the lesser degree potential exposure areas would be similar. But a lot of times people have kind of thrown out the number, and there is no specific number out there, about 25% of people. So you can use that number. But again, it depends on how many different parameters that you can think of in which the work would take place.
Okay, and another question, is testing required by regional area, brand area, or is it job site specific?
Again, that's why I think it's a great idea to start developing and getting as much objective data and sampling data and creating your own table so that you don't have to do it on a site-specific basis. So you can, if let's say Cal OSHA came to the site and you haven't sampled someone for silica yet, but you could prove to them, hey, we've done this on various occasions, it's within our written exposure control plan. So we have a table 2 here, and we have identified that if they do it, the work in this specific way with these specific parameters, that the exposure levels will be at this level, and this is a type of respiratory protection they need, or that they don't need it. So once what I keep telling people is that for the first year, I believe, or at least the first year or 2, you will probably be reviewing and auditing your written exposure control plan probably various times, and not just once a year, because you're going to want to try to get as much data as you can to try to prove and try to be within compliance to show that we don't necessarily need to collect a sample at every location, because we've already identified that when we do it in this specific manner, that exposures are below this number, or that they are above this number, so this type of respiratory protection program is in place. So instead of treating everything project specific, start thinking company-wide how you can help control dust. And then every once in a while, maybe the project has something that's a little off the wall or does not fit within that specific table you've identified. Maybe then you'll start a new one and collect some more samples from that person to help identify whether or not they need to have specific respiratory protection.
Great. And then one more question. Is it feasible to share testing results between companies?
I don't see why not. I mean, again, the performance option within the alternate exposure method says that you can combine a combination of monitoring data or objective data, which would include industry data, prior exposure assessments, or research. So to me, that means if you gather enough information, and again, you can prove that your employee or the person doing the work does fit within those parameters, then yes, I feel like that would be objective data that you're using in order to develop your control methods. Okay, so what should you do now if you haven't started anything yet? Well, first you'll have to determine if this standard actually applies to you. So the drywall person the person who asked the drywall question, if that's all you do, maybe it's time for you to determine if you even need to have the standard. Does it apply to you at all? If you work in construction and do any concrete work or masonry work, I'm pretty sure it will, though. So if so, it does apply to you. You should start beginning the development of your silica management program. So again, that will include developing a written exposure control plan. And I suggest that you discuss with the higher ups what exposure control methods or strategy you would like to follow. So as I say, there's various pros and cons for both versions. You can use, again, you can use the specified exposure control method, which is table 1 within the Silica standard, or you can use the alternate exposure control method approach. So you have to see whether or not the cost of medical surveillance and respiratory protection program, which is necessary in table 1, is feasible for you. Because again, if you are a large construction company, maybe your turnover is so large that that would just be an astronomical cost, and you may want to go with the alternate exposure control method approach. So again, there's pros and cons for all plans, so I suggest you discuss that with your group to determine which one works for you. And you can also follow a little bit of both, because one company I've worked with, we are using both the table 1 and also starting to develop a table 2, where we will use the alternate exposure control method approach for any time we feel that table 1 cannot be performed properly. So now, how can facts help you? Because I'm sure you're probably a little bit overwhelmed at this time with all the information I gave you. Well, we can assist in the development or just the assistance in creating a silica management program for you. We can help assist with the development of written exposure control programs. This could be either company-wide, or if you'd like a project-specific plan. We can develop or review your respiratory protection program to determine if it's still compliant, although there's no changes with the respiratory protection program, but if you want to make sure you're up to date on that, we can assist you on that as well. We can help with the hazard communication training on silica exposure. We can assist on developing and presenting competent person training. We can assist in exposure assessment and do the actual air sampling for you, or we can even assist you in developing or obtaining that objective data. So there's several things that FACTS can do to help you and to, hopefully simplify and make this process of the new silica standard easier for you. So that's all I have. We have probably, I think we have 2 more minutes. You can ask questions. If not, people can email me questions if they think of something a little bit later, or contact me. I don't know if Carly can provide that information later to anybody, but I'm here to assist if you need some assistance.
Yes, we will send out a follow-up email so you guys can have a recording of the Silica webinar, and I will also include Michelle's contact information. So if you do have any questions after we close, you can definitely contact her and ask her, and she can follow up with you.
Okay, if there's no more questions, then we'll go ahead and end this.
Thanks so much, everyone, for attending. We really had a good time showing you the new regulations, and we're looking forward to working with you in the future if you need any help.